Speakers today. The keynote speaker is Dr. Sarah-Patricia Breen, BC's Regional Innovation Chair in Rural Economic Development at Selkirk Innovates at Selkirk College. Joining her in this discussion are Stephanie Ellens-Clark, Executive Director, and Charlene Tolton, Manager of Programs and Services at One Care, a not-for-profit based in Huron and Perth counties. And joining them as well is Stephanie Stewart, Manager of Community Transit at the County of Grey. The views and opinions of many speakers in this webinar may not reflect Gateway's, but we believe in providing a platform for meaningful discussion. And now I'll pass it on to Sarah to discuss more.
Thank you. So I have a slide deck ready to go. I will share my screen, and can I get a thumbs up if folks can see my screen? Perfect. So thank you for having me today. I'm joining from Nelson, British Columbia, where I work for Selkirk College. And as a rural college, we have campuses across multiple communities on the traditional territories of the Snakes, Syilx, Ktunaxa, and Secwepemc peoples. And over the next 12 to 15 minutes, I'm going to start with a little bit about me. I'm going to talk about what we know about rural transit in Canada and why it matters. A little bit about the challenges of rural transit. I want to bring in some examples of collaboration and talk about why that's so important. And then end with some calls to action or things that folks can do to help improve transit in their communities. So just to give some context about who I am and how I got into this conversation, as Sage mentioned, I'm the Regional Innovation Chair in Rural Economic Development. And so my role is primarily a research-based one. There's a web link there if you're interested. I'm also adjunct faculty at the University of Guelph and was originally from Ontario. For those who are unfamiliar with the Kootenay region in British Columbia, Nelson's in the mountains in southeast BC. When I'm not doing research, I'm usually outside biking or hiking or skiing or something vaguely dangerous. That is me in the blue and green at the head of that particular trail on the photo. How I got involved in researching transit, in 2020, the federal government put out a call for a type of grant called a knowledge synthesis grant. And basically the purpose of that is to gather up all the pieces of information that we know about a certain topic. This one in particular was related to transit, and so I applied specifically with the aim of compiling what we knew about rural transit in Canada. And there's a web link for that project there as well. And so much of what I'm going to say today came from that work and some related spin-off projects. And just one note before I continue on, most of my research focuses on inter or inter-community transit that is the kind of frequent trips, so weekly or daily trips, not the Greyhound style going across large distances once in a while type of transit. So what do we know about rural transit in Canada? Not much is kind of the easy answer to that. There really isn't a lot of academic literature out there. There's some gray literature, and the slide is a summary of what my team found. And there's a couple of key points on here. When we look to the literature, what we see most often is that rural is super generalized. There's, like how to do rural transit. This is a problem because it fails to consider how rural communities are different from each other and the influence of place-specific factors. This would be a problem if we were only talking about Ontario. In a country the size of ours, this is a major problem. The second issue up there is that what we do know is very geographically uneven. So the information that we have when we get into place-specific details, it's dominated by larger, more urban adjacent rural communities, typically in Southern Ontario and Quebec, or regional systems that exist in British Columbia because we have a provincial transit authority. This is a problem because it leaves large gaps in our understanding of what we actually know about rural transit for places that aren't those three provinces and the southern portion of those three provinces. A few other examples of patterns from things that we learned include a lot of the systems are connecting multiple communities together, which makes sense when you think about it. My doctor, for example, is in another town about half an hour away. The main campus of the college where I work is in a different town about half an hour away. So it's very much a regional system. Pattern-wise, we see a lot of commuter-focused systems in Southern Ontario, whereas, as I mentioned earlier, BC's got a large number of these public regional transit systems because of our provincial transit authority. Whereas if we look to the other side of the country, Atlantic Canada is primarily dominated by volunteer-run services, and there were few, if any, examples in the prairie provinces. What the bottom line here is that there's massive service gaps when it comes to rural transit options in Canada. I want to talk a little bit about why transit matters. Often when people start talking about transit, it's talked about as if it's an urban topic, but it's very clear that it is just as important, if not more important, in rural places. It offers an opportunity for improved social, economic, and environmental outcomes for rural communities. And it's important for individuals as well as for the communities as a whole. So if we look from an individual perspective, this is very much access to basic services, critically important for healthcare, particularly for seniors. And that's whether you're visiting a family doctor or a specialist or going to testing at we have a regional hospital in the area where I live, and that regional hospital is an hour away. So we have health transit specifically for that hospital. It's also really important for community participation for individuals, whether that's shopping or socializing, and whether or not transit exists and how good it is has a disproportionate impact on seniors, as I had mentioned, but also on youth and newcomers and other folks that have distinct needs. From a community perspective, transit relates to job creation, resident attraction, workforce retention, access to shopping and markets, reduction in greenhouse gases, and it enables aging in place for our communities. Wanted to mention a little bit about what the barriers and challenges to rural transit are. And I know that that is quite a diagram. You don't have to worry too much about reading the fine print, but I'll hit the high points for you. Basically, what we saw in our work was that if we look across the country, it's a patchwork of what exists and what's accessible. Rural and small communities across Canada are inequitably served and they're inequitably funded as well. And we identified different types of barriers to sustainable rural transit, and that's that pie diagram there. And so kind of the each color is a different classification of barriers, and as you move further out, those get into like finer and finer slices of them, if you will. Some of the barriers are universal. They apply to all rural places. Typically, this is going to be around cost is one of the ones that we see as a universal rural transit because on average, rural transit systems are going to be more expensive because of larger distances and lower population densities and fewer potential riders. But we also see these place-specific challenges that can't come in as well, and that relates to travel patterns, economic structure factors, geography, physical geography. So I have to deal with mountain passes. That's less common in Southern Ontario. Travel patterns for, say, like a shift work community are going to be very different than a tourism-based community. Those types of factors play a huge role in what transit is needed and what it's going to look like. And remembering that we have this issue of rural generalization, that place-specific challenge piece gets left out a lot. So we don't understand a lot of what we need to. Multiple jurisdictions are responsible for transit in different ways. And so, the easy way of saying that is that there's a lot of people involved in this. There's local governments, provincial governments, potentially federal governments. There are non-for-profits, private companies. It gets to be complicated. And there are, unsurprisingly, issues with programs, especially funding programs, and I have an entire slide for that because it kind of deserves specific mention on its own. So, funding challenges. Two main issues we ran across. This spun out into its own separate project because I couldn't stop looking at it. Basically, what we found was there's a lack of rural specific funding for transit, and that really plays into this idea that rural places don't need transit. What we saw was there was no funding of rural transit prior to the existence of the Federal Rural Transit Solutions Fund. And from a policy or program perspective, this often leads to the assumption that, oh, they're not applying because they don't need it. And that is not a correct assumption. It's an unfair competitive grounds. What you have in more typical funding programs for transit is putting communities like the one where I live, which has 10,000 people in it, in competition with Vancouver, that is, you know, I don't know how many million they're up to at this point, but it's not a level playing ground. The applications can be incredibly onerous, and therefore small communities typically don't apply. So prior to the Rural Transit Solutions Fund, we found that when it came to federal funding of transit, that the majority of the money was going to local governments in urban communities in Ontario. And I mean, like, exponentially more money was going to Ontario, more money than most of the other provinces combined together. Whereas when they put the Rural Transit Solutions Fund into place, we saw a significant change in the types of projects that were being funded and where those projects were. We see representation across the country. You also see a lot of funding of nonprofits and, pardon me, local governments in small communities. The interesting note here is that that fund primarily funded existing systems. And that's because of the creation of a dedicated rural transit program clearly made a difference in being able to show that there's a need and funding what's out there. It wasn't perfect because you couldn't fund operational funds. Basically, you could purchase buses and infrastructure and things like that, but it overlooked that need for consistent, predictable operational funds, which meant that not a lot of new systems were getting created. Shifting gears, so that I don't, just rant on funding programs all day, I want to talk a little bit about potential solutions for transit. And I really want to highlight the importance of collaboration on this. And this is for a few reasons. Transportation systems need to serve users, and we live and work and play in regions, especially in small communities. As I mentioned earlier, it's very common for us to move between communities, whether it's for work or school or shopping or doctors or things like that. And so our transportation systems need to serve the the desires of users, and that includes the second point on there, which is it needs to include multiple modes of transportation. So not only can it not stop at the edges of a single community, but it needs to create connections between modes of transit, especially on that first and last mile, so that we're able to walk or ride safely to a bus stop to get on the bus. In a lot of the communities that I work with, there aren't sidewalks, for example. You're getting off on the edge of a highway, which has safety implications to it. So we need to consider how to create these connections between different systems, even if those systems are run in different communities by different groups. It's really important for us to be working together. And then the third part there is collaboration enables economies of scale. When I talk to community groups or local governments, nobody has an abundance of money or people or time to do all of these different things. We all have serious capacity limitations, and working together is really important for us to essentially maximize the resources that we do have. And so I have a couple of examples that I wanted to point to just to illustrate this. And the first one, I brought some examples from BC, figuring you folks were probably familiar with other examples in Ontario. So Eagle Transit is an example from Haida Gwaii, and this is a multi-partner collaboration between a First Nations-owned community service group, the Provincial Health Authority, and a private transportation operator. So they basically have multiple groups working together, including support from Northern Health, so the Provincial Health Authority, as well as credit unions and a tourism group, to create this multimodal system where there's a public aspect to it where they collect fees, but it has a medical transit aspect of it. So those fees are covered if it's medical transit, basically. So they're long distance taxis, charter buses, charter vans, freight, all sorts of things. Population of Haida Gwaii is about 5,000 people spread out over a very large area, and collaboration is the only way that they're going to be able to have these services. The second example is one that I'm quite familiar with because it's in my neighborhood, right in my backyard in the central Kootenays. And what they've done is created a rural mobility working group. And so this is kind of gets to that recognition that there are a lot of players in this system and we need to be working together. And so it's local government, community futures, transit authorities, seniors advocates, youth representation, active transit, and our car share working together over 2 years to identify a series of small projects that are of interest to everyone and figure out how we can work together to support those projects and make those connections. It's very heavy on the multi-group engagement and input, geared towards practical and actionable insights. New routes for transit, secure bike storage rather, safer infrastructure, and so on. So, as promised, I wanted to leave folks with some sort of call to action of what they can do, some ideas that they might want to consider for things you can do to help, basically. And I pulled from Dr. Seuss because I wanted people to get something like an earworm rhyming in their head. I want people to collaborate like you are the cat in the hat. So, like on a train, in the rain, as many different rhymes as you can, whether it's in your town with the town next door, with organizations that do the same things, with organizations that are related but different, shared services, shared infrastructure, sharing data. Sharing parking passes, I don't care what it is, as long as you are finding ways to work with other folks. That can include asking about the experiences from other places and other communities. And the most important thing, do it when you don't want to. Do it when it's hard. Do it when the program that you end up working on might not be your top priority because eventually it will come around to be the thing that is important to you. Want to encourage folks to try new things, to pilot, to learn and iterate and improve. We've seen a lot of cool things coming out with transit, including communities, small local governments that have one or two fleet vehicles that they ended up using like a car share in evenings and weekends so that they can make some additional money from their fleet vehicles. And I want to encourage folks to communicate clearly and positively, whether that's to local governments, to provincial governments, or federal governments. And I mean positive as in you are coming with solutions, not just challenges. And solutions, especially in our current fiscal condition, cannot simply be that more money is needed because that is completely true and none of us are getting any more of it. So we have got to figure out more creative solutions in order to be able to move forward. So I think I'm at least mostly on time, and I will leave it there. I will share my email in the chat box so that folks can see it, and I will stop sharing and pass it over to Charlene and Stephanie for our next presentation. Thank you.
Thank you so much, Sarah, for really setting the tone and sharing the places we can go. I was trying to make a Dr. Seuss reference there. Uh, I'm really known to do a lot of transportation puns, so you might hear some throughout this. My name is Stephanie Ellens Clark, and I'm with One Care Home and Community Support Services, and I'm here with my colleague Charlene. And we're going to co-present on our program, transportation, but we offer many services, so I'm going to speak to that a little bit as well. But we also want to share. Um, our challenges and, as Sarah said, solutions that we're working through in partnerships. So this is really where the rubber hits the road. We're trying to give you an example of a rural transportation program. And we know that there are many programs that exist across Ontario and, as Sarah spoke to, across our beautiful country. So hopefully you can learn some things from us, but also we're excited to be here and learn from you. So One Care Home and Community Support Services is a trusted local nonprofit. We actually offer a wide range of tailored home and community support services that support older adults and people with health challenges to live independently at home in Huron and Perth counties. And I'm going to show a map and speak a little bit more about our rural context. But this is everything from personal care, meal delivery, to transportation, obviously, social programs, caregiver support. I think we have about 20, 21 programs. So we really want to be a one-stop connection for services for people in our community. And really, our vision is quality health and well-being at home. So it would help if I can move us along. There we go. So our rural context, we are in southwestern Ontario. So what Sarah was referring to, we are urban adjacent, but that doesn't mean that we don't have rural challenges because we have 150,000 people population spread across 5,600 square kilometers. So you can imagine people, very low population density, and people are spread apart. So our urban centers, I guess you could argue, our cities would be Stratford in Perth County and then Goderich, which is a small town. Actually, I think it's known as Canada's most beautiful, prettiest town, I believe it is. And that's right along Lake Huron. So we do have also similar challenges around weather that some other communities would have because of lake effect and different things. I wanted to share with you our existing transit systems. So it's a bit different than the urban communities in that Stratford, being a city, does have a bus system that's route-based, and they do also have accessible transportation. We also have a smaller organization, Huron Shores Area Transit, that serves Lambton and Huron counties, and then Perth County Connects, which is in Perth County, picks up people route-based in the smaller communities and helps get them to their urban adjacent communities like Kitchener and in Huron, trying to get them to London and different areas. There are no Ubers. People are surprised to hear that when they come to our communities. And so we do have a few taxi companies, but it's not as many as you would see in an urban center. I think in one community locally, we have the one guy that drives the taxi. And so you can imagine again, not a lot of access. And then we have our Easy Ride partners. So Charlene's going to speak a little bit more about this. It's a partnership that we are a part of. We're one of the five, and it's a great collaborative, like Sarah was chatting about. So I'm going to pass it over to Charlene, who is going to cover our program.
Thanks, Steph. Okay, so our transportation program is a door-to-door on-demand service with pre-registration required. Once registered, a typical ride requires 2 business days notice to book by calling our Easy Ride scheduling team. With the exception of adult day program rides, our transportation is not route-based. The service is available 7 days a week for those who are eligible, and ride bookings are taken Monday through Friday. A large portion of the ride is covered by Ontario Health. However, there are still client fees and fares applicable. Fees are based on distance of ride, vehicle type, and service being provided. Our transportation is not an emergency service. To be eligible for transportation, a client must be living in Huron or Perth County, be an older adult, so 65 plus, or be an adult with a disability, or an individual with short-term disability, such as a broken leg or recovering from recent surgery. One Care offers rides to members of Huron and Perth communities for medical appointments, adult day programs, shopping trips, home from hospital, and social outings. So, based on this, or looking at this slide, so we currently have 16 vehicles in our fleet at OneCare. This includes mobility buses, mobility vans, a caravan, and a food truck. The food truck is a part of the fleet, but is dedicated to our Meals on Wheels program with OneCare. Transportation is interconnected with other OneCare programs that are offered. We provide transportations for some of the hospital to home programs such as Home at Last, Let's Go Home, and Transportation with Attendant. Additionally, we provide transportation for adult day programs and nursing clinics. The transportation program with OneCare delivered approximately 45,000 rides in the 2024-2025 fiscal year, with 86% of those rides being for medical appointments or to the adult day programs in our communities. So the Easy Ride Partnership. So OneCare is one of 5 community support agencies in the Easy Ride Partnership that delivers door-to-door transportation for older adults or people with health challenges in Huron and Perth County. The Easy Ride Partnership was created in 2007 with the Aging at Home strategy. By teaming up with other agencies and sharing our vehicle and driver resources, the partnership, a collaborative service, was established to improve access to transportation, so expand and enhance existing transportation, reduce duplication of services for individuals, reduce confusion of who to call. So there is one number to call for the intake or registration of the services and one number to call for scheduling for all 5 partners. And the booking standards are the same for all Easy Ride partners as well. The partnership increases the potential for efficiency in ride provision, and standardized policies and procedures were created in providing client service. OneCare is the host of the scheduling team for all the partners, and the Easy Ride partners meet regularly and continue to explore opportunities to enhance our services. So I'm going to share with you a story of a client named George and the challenges that he has in the affordability of rural transportation. So George started using Easy Ride for transportation to and from dialysis appointments from his home in South Huron to the city in September of 2025. He currently attends dialysis 3 times weekly. He is supported by the kidney team at the hospital. Soon, OneCare drivers began to raise concerns as George was expressing anxiety over the cost of the rides. Dialysis rides require wait time, and when you're bringing a client from rural Ontario to urban centers, you're rarely able to eliminate the need for transportation to wait. A round trip for George would cost approximately $172 per day. His annual income was a few $1,000s below the projected cost of his rides in a year. He had exhausted other funds such as the Kidney Foundation and rides provided through the Let's Go Home funding. During a care conference, it was noted that once he was stable, he may be eligible for a dialysis at a rural hospital satellite site. This would be more efficient as Easy Ride could fill the wait times with other local rides and not have to bill George. George was eligible for OneCare subsidy provided by fundraised dollars, but as that is a small pot for all clients, OneCare could not sustain that amount to support. One-time support was also located or secured with 3 local churches. An application was submitted and approved by the Easy Ride Partnership for dollars from the Special Transportation Fund. Again, a small pot of money that is available for circumstances such as this. The work and efforts from many parties ensured that George was able to continue to receive his transportation services to dialysis without as much stress or skipping these critical appointments. Social work continues to work with George on budgeting and seeking additional funds to support him on this journey. I'll pass this back to Steph to discuss our current state.
Thanks for sharing the story of George. I think it really illustrates some specific challenges, especially for our clients as well. So I'm going to cover kind of what we've learned to date, but also how we're currently operating, and then kind of go into some solutions that we're looking at. So we are looking at budget deficits, operating with budget deficits, and part of this is due to a number of the reasons below in terms of our fleet and also costs for staffing. So just to paint a picture for you to understand, we are very grateful, obviously, to our funder, Ontario Health, but some of the challenges that exist is the fleet is aging. So as you can imagine, as vehicles age. I was out the other day with one of our vehicles that's almost close to 600,000 kilometers on it. It doesn't have much life to go. So we have to pull vehicles off the road to have them in for servicing, for safetying, but also in the case of when you may have a vehicle that needs a new part and you may not have the funds for it. Then we have loss of volunteers. Over the pandemic, we lost a number of volunteers, and also specifically in the transportation program. And we've taken a huge hit, and because they're critical. So, as you can imagine, if you have a client that is ambulatory, able to move around, and doesn't need an accessible vehicle, it's far more efficient to have them go in a volunteer's vehicle than to go into, like, let's say, a 12-passenger accessible vehicle, because of, the maintenance costs, the vehicle sitting there if you were taking them on a long haul trip. So we know that volunteering is amazing for community development and the impact that the volunteer gets out of it, but also the efficiencies that it provides. We have tried purchasing, as Charlene mentioned, a minivan to help offset that a little bit, to have an accessible minivan available, which we're hoping will help with some of those longer hauls, but we still need the volunteers. So that actually speaks to the next point, which is the evolving client needs and demands. Across the community support sector, we are seeing people with a lot more complex needs. This is, I mean, in a way, it's great. People are living longer, which is awesome. But we also know that with that comes complexity, which requires maybe, in the case of George, more rides per week. Or it could also be that you need to go for an appointment that is a far distance and then have that wait time that Charlene was mentioning. And in addition, we also know that our system is evolving too. And so we're trying to find efficiencies. Let's say having MRI open in Kitchener at 3 a.m. And that's great because we want to use those machines at all time of day. But then that creates a demand on a transportation system to get someone in the middle of the night to drive someone to that appointment. So lots of changing things that are happening with the program. We did engage with Dylan, and I know Stephanie, our next speaker, is going to speak more about working with Dylan as well, just to look at our current picture and to really understand what is going on. And that study was done in 2024, and a number of recommendations were made that I'm going to talk about that we are actioning, but some of them it was hard because they felt a bit out of our scope. So sometimes it's like, what can you control within your scope and without, but also are there innovative ways you can think beyond your scope too? So one of the things we do still find a challenge though is really understanding the demand. So the bigger picture needs and the long-term needs. It's still a challenge because we know the people that we're serving, but we imagine there's quite a few other people that need supports and we aren't able to reach. So we are working on a transportation redesign to improve our current operations and find efficiencies. So I'm going to just mention some of our next steps for sustainability. So there's really this tension between balancing long-term and short-term vision. So ultimately, we want a sustainable program, but a lot of our efforts are having to focus on the short-term needs because we're in this deficit and also having all of our vehicle challenges. So we do have a vision. We do see the value, and as Sarah mentioned, all the health outcomes, all the amazing things that community building, belonging that come out of transportation program. So we want to keep doing this program, but we also understand that we have to balance this with how do we make it happen and how do we find that sustainability. So we do have an immediate strategy for funding vehicle replacement and maintenance, but we're also trying to push to think more longer term. So this immediate strategy is including a capital campaign called Driven to Care. So it includes everything from 50-50 draws. So we're really relying on our community and asking them to help to fund the vehicles. And it also includes advocacy component. So we are working with the Ontario Community Support Association, talking to our MPPs, a number of other potential people that could help with this movement. But the challenge, as Sarah said, is the money isn't necessarily there. So how do we come up with these innovative ways? So part of that is looking to enhance our partnerships. So we are pretty fortunate to have the Easy Ride and put a lot of work into that. All the partners do, but there other ways that we can look to further enhance how we work together. We do have some relationship with the municipalities, but again, looking at is there ways to get at the gas tax. So some of our partners actually get gas tax for their vehicles, and so could we work with our municipalities, or could we consider ways to plan and collaborate together? Fairing is a difficult one because you think of George and the ethical component of it all. We have to find a way to make it reasonable for people to be able to afford, but we also need to have the fairing cover the costs that aren't covered through our funding. So we are looking at a fairing increase, and so that has because you consider the gas costs and different things as well. And then because we need 100 volunteers is what we're looking for drivers. So if you're in here in Perth and are willing to drive, we need you. But part of this is also looking at new models. So if we look across Canada, are there any really innovative ways that rural agencies are looking at recruiting volunteers? Maybe there's partnerships with churches. There's different things that we can try. So that's a space we see as could have a huge benefit for our transportation program. And then there's a lot of operational practices we've looked at for efficiency. So one of the examples I can give you is we were able to upgrade our mapping system, for example, to ensure that we could have the schedulers provide the best route for the drivers. So, and to find efficiencies in the routes. And then we're also considering resuming charters. So we previously offered charters for long-term care for social outings and different things. And that's something that we're exploring. So this last slide is just our contact information. That's not Charlene and I walking off into the sunset. We actually are walking towards the issue and also available to chat. So we put our contact information in there, as well as our line if anyone is interested in services or wants to share that information with people they know in Huron and Perth. But in addition is to say that what you can do, I don't have Dr. Zeus up here, but I would say that there's a couple avenues to visit onecaresupport.ca. There are volunteer opportunities. We do have 50/50 draws. We have sponsorship opportunities for vehicles. But there's also a really interesting campaign happening through Ontario Community Sports Association, if you are in Ontario, called everyoneneedscare.ca. And it's an opportunity to send a letter to your MPP to talk about the community support sector in general and the importance it has. And what we know that it actually helps prevent hospital stays and long-term care admissions, but helps people age in place. So there's really an opportunity to raise your voice there about the importance of the sector. So I'm going to pass it off to Stephanie Stewart.
Perfect. Thank you so much. I will share my screen here and just go through a few slides talking about our project. Okay. Wonderful. So as mentioned, my name is Stephanie Stewart, and I'm the Manager of Community Transportation for Grey County. I'm here today speaking on behalf of the project team, which is made up of staff from Grey County, Bruce County, Dufferin County, Wellington County, and Saugeen Mobility, which is a specialized transportation provider in our region. Collectively, we are in the process of doing a regional transit study to design and assess the feasibility of a unified regional transit network across all 4 of our counties. The goal of our study is to expand the coverage of transit across the region, create a seamless experience for passengers, find efficiencies of operating an integrated network, create a central knowledge base for transit governance and operations regionally, enhance overall network efficiencies, promote equity and accessibility for residents of all ages and abilities, create a system that grows ridership by improving service quality and the reach, and assess the feasibility of transit once provincial funding ends. So these are kind of all very similar and touch basically on what my peers just spoke about. So it's kind of interesting to see how we're all aligned but in different pockets of this sector, which is cool. So right now we are in phase one of our project. So we, as mentioned, we are working with Dillon Consulting. We have hired them to help us kind of develop this future plan. We have, done our engagement and we've talked to many, many folks. We've done public open houses, we've done community surveys, we've done focus groups, we've done a counselor specific session, we've held stakeholder meetings. So we've really tried to talk to as many people as possible to ensure that we're really understanding their needs. Through this, phase one, we're also looking at potential service models. What should the fares be? How do we integrate seamlessly with things that already exist? How do we integrate into technology that's already happening? And how do we really try to make a great system for as many people as possible? Also recognizing that, as mentioned by OneCare, we live kind of in a rural area, but how do we still help those folks who need to get around, even though the demand maybe isn't as high, but the demand as in there's not as many people, but the demand is still there because people definitely need service, regardless of where they're living. So we are presenting to our councils in March, the first round of our presentation, and then we will come back to them with a final plan in May. And assuming that they approve our proposed plan, then we would move into phase two, which provides us with the opportunity to implement our project between 2026 and 2030. Obviously, the phased-in approach will continue if approved by council, but we have funding, partial funding towards this project from OTIF. So we, as the three counties in this project, plus SMART, we received 9.5. Well, I almost got that wrong. Up to 9.5 million, 9.3, 9.5 million from the province. The number is escaping me now because I'm on the spot, to put towards this project. Of course, all of our counties also need to contribute as well, but that is a significant investment from the province of Ontario towards this great work. So we're very, very excited for their contribution. I won't go over this too much because all of my peers talked about it too. Why is this work needed? Exactly what everybody else said, the exact same reasons for our community as well. If you'd like to learn more about the project, you can visit our webpage and it tells you a bit more about our specific scenario. As mentioned, we did our engagement. I just wanted to highlight, our engagement went really well. We had 3,790 surveys completed, which is pretty significant. And it really showed us kind of the needs and where people are wanting to travel and why they're wanting to travel. Again, as mentioned, we're currently here in our second round of engagement. So I'll be presenting to Grey County Council on March 12th. We will be presenting to Bruce County Council March 19th, and Dufferin County and Wellington County as well. And then to the Saugeen Mobility Board in March, sharing kind of what we've heard so far through all of this engagement, seeking council's feedback and also seeking public feedback. From there, we'll take those notes that we've received and then finalize the plan and come back to them in May. So in regards to the call to action, I would really just emphasize once you see our council presentation in March, they will be streamed live on YouTube. Please feel free to take a look at what we've presented and provide us with your thoughts and your feedback. Let us know if we heard you correctly after that first round of engagement. So that's really our call to action and our ask from the group here today is to just take a look at what we've presented, see if we heard you right, and let us know. And then really, if and when we are successful and we launch a new system, please use it, because that's really the way to sustain it long term is through ridership and showing our members of council that there really is a need from our general public. So I'll pass it back to Sage because I know we wanted to open the floor up for questions, but we're really excited. It's nice to hear Dr. Sarah say all of what she shared because it's true across, the entire country, but then also to know that our partners, in Huron and Perth are also looking at transit because we can connect into their system as well and try to open up this rural network for more folks. So it's exciting work. So thank you.
Thank you to all the speakers for presenting. I really felt that we had a really fulsome idea, but we can always learn more. So if there is anybody that would like to ask any questions, please add your questions to the question and answer box below, and they will be answered by our speakers. So we already have two, and I have Gwen, and I'm going to direct it to Stephanie Ellens Clark. Gwen asks, can you tell me where you get funds for new vehicles/vehicle replacement?
Sure, thanks for the question. So previously, with our funder from the government, we did receive capital funds built into our budget, but the recent budgets that we've been working with don't include capital funds. So sometimes there's different ways to go about it. It puts us in a bit of a pickle, I guess you would say. So we do work with them and talk about our needs, and then if they are able to find funds for them, that's one way. Another way is really through the donation aspect. So we have had in the past some sponsorship aspects where we've had vehicles, portion of a vehicle donated by an estate or by a local company. And then the other piece is from this Driven to Care campaign. So we are bringing in enough funds to purchase a few new vehicles. I guess the concern though is the sustainability aspect, the long term, because I don't think it would be fair to continually be asking our community to fund the vehicles. So that's why we are looking at the gas tax aspect and trying to see if there's other ways, whether it be through grants. We're always putting in grant applications and different things as well. So yes, it's a bit of a quagmire, I guess, that we're in.
Amazing. Thank you. And I actually have a question for myself to Sarah. Rural transportation is connected to economic development. How does transportation play a role in recruiting and maintaining a diverse workforce in rural areas?
Yeah, it's got a lot of different connections to it. And I know we had talked about some of these questions in advance, so please forgive me if I'm looking at my other screen to make sure that I don't miss any key points here. So I like to think of it as transit systems can allow like a market-based system, which is what we have, to work more efficiently. So I live in a small town that's what I would classify as a high amenity community. It's a really pretty place, if I do say so myself, and a lot of people want to live here, which also means that housing prices are crippling. And we, as a consequence of that, we have a 0% vacancy rate, and there is not a service sector business in our community that does not struggle to retain bartenders, servers, wait staff, those types of things, because it's really hard to live in this town on that type of salary. That's an issue of itself that needs to be addressed. But transit can help with this as a problem because we have communities that are our neighboring communities that aren't as amenity rich, that have higher vacancy rates, that have places for folks to live. If we can create that functional transit system between those places, all of a sudden folks can live in those communities without having to, like in those other communities, without having to own a vehicle, which is expensive on its own, able to get to work. It has benefits for one community in that we have a functioning workforce, benefits for the other communities in that there's increased people living there, those types of things. But there are examples of our transit systems where this doesn't quite work, for example. So I had just one brief anecdote to illustrate this. I had a student working for me, and she was doing a survey in a town called Selma, which is about half an hour that way. And she would take the bus out there, which ran twice a day, not early enough if you had an early shift, and not late enough if you had a late shift. But she managed to use it to get to and from Selma so that she could do her survey work. And I get this call from her one night that says, so they've canceled the bus because the bus driver's sick and we don't have a workforce enough for the buses for them to have a replacement bus driver. And so I've got this student who's like 20 stuck in Selma, and it's not like she can walk back. So I end up having to drive out to get her and bring her back. And her observation on this was not everybody's got a boss who's going to let them get away with this. Not everybody's got a boss who's going to come and pick them up. And so at any rate, it's a huge advantage for recruiting and retaining workforce in communities and building that more functional region if you can shift people between places, and not try and have this single self-sustaining community where everybody lives and works in place, because it just doesn't work that way anymore.
Thank you. And there is another question from Barbara Dobreen, and I'll direct that to Charlene. So, to home and community support for the volunteer drivers, older adults that want to volunteer may not be able to afford some of the aspects. They mention additional insurance, maintenance, and fuel. Are there supports given to those volunteers for their personal vehicles?
Yes, absolutely. So we do pay mileage to the volunteers who are supporting our transportation program. Um, and as you said, the cost of insurance, the cost of operating a vehicle is quite expensive. So it is the little bit that we can afford to be able to pay them for supporting the volunteer program for us.
Thank you. And then there is an anonymous person that I'll direct actually to Stephanie Stewart. They asked, because you're building out such a large regional transit plan, is there consideration of transit systems that does it extend outside the area? What have you seen so far in the responses to get to those other larger centers?
Yeah, absolutely. Thank you for the question. We have had a couple of folks who say they want to go to London or to Toronto or Kitchener, for example, for health appointments. And so those ones we're looking at relying on our community care organizations to help get them there. The conversations have begun too about how do we work similar to what One Care did, right? Like, how do you get all of those different agencies on the same platform? So while my focus is mainly on conventional transit and helping people navigate the conventional system, we recognize there's a lot of opportunity for synergy in the community care agencies as well, because, one agency is taking two people to this hospital and that agency is taking two people to that hospital. Maybe they could all go together. So how do we navigate that? So it sounds like One Care's kind of figured that out. So we'll look to kind of use similar examples in our communities to model that. In regards to conventional transit, we are looking at how do we make those connections to Go Transit in Orangeville, in Guelph, in Barrie, in Kitchener, and how do you kind of help make that seamless connection? So trying to reduce transfers, trying to make fare payment easy, trying to make a platform where you can say I want to go from here to there. And not make people have to figure out five different transit systems to be able to get to their end destination. So we maybe can't take you in one vehicle the whole way there, but we're looking at trying to make it a little bit easier to navigate for folks.
I can see that Sarah has been starting to answer some of the questions in the chat, and I do want to highlight one particular question. Um, at the bottom, Ray Neto, I hope I got that right, asks about the programs. They include transportation to exercise facilities, from parks to gyms, as well as mental health services. And is there any plans to change the spatial distribution of these programs? And they want to specifically direct this to Sarah. Thank you so much and congrats for the work from an M-Plan applicant and previous graduate co-op from Selkirk College.
Sorry, I was half typing a
Mhm.
response to the question about Saskatchewan data, which is like proof positive that one should never try and do two things at the same time because you'll just fail. Um, so programs including transportation to exercise facilities and mental health systems. So yes, no, sometimes. It's really system dependent, I guess it would say. We saw when we were looking at the federal granting system, we did see a very high number of active, what we would classify as active transportation related transit grants. And so that could include things, say, to exercise facilities as well as like routes and buses to exercise facilities, but also things like pathways and more accessibility for people to get out there, or things like putting bike racks onto buses and that type of thing. Hopefully that answers that question. And then because I've lost track of it, for the person who asked about the Saskatchewan data, I just put a link to a conversation article in there on, the three authors of that article write a lot about Saskatchewan and transit. And so I would highly recommend looking up Jacob, Cindy, and Lori. They've done the most work on that. So that hopefully can answer that question. And I'll stop trying to multitask.
Thank you. You seemed very successful. And then I actually have a question for Stephanie Stewart. What is the value of creating a regional transportation system? 4 counties involved from the get-go. What is the value of that?
Yeah, so often we've heard from council individually, like, how are you going to sustain this? How are you going to make this work? Why is this time different than the previous times? And really, my answer to that is now we have lots of people at the table. Everybody is there. We are all working together. We also have funding from the provincial government. We also will be able to tap into gas tax, as mentioned, right, by One Care. So it kind of makes it easier for that. There's the financial benefits, so the economies of scale, as noted, we can purchase things together, which is always great. There's the operational efficiency, so you can reduce duplication, and a better passenger experience, like I just mentioned. It's also easier to navigate for folks. There's like a central booking platform, and it really just gets rid of those artificial boundaries because people really don't know where they live. Canada Post made these boundaries, and now we must all abide by them. But the bus stops at these boundaries, and we need to get rid of them because people don't live by that. So that's really the benefit of us all working together, is to allow people to travel seamlessly across the 4 counties. It also just kind of helps leverage our voice. So when we get in front of, our members of council and in front of the province, we're able to say, like, this is really what we hear, and we're hearing it from this large area. And I think that kind of makes a difference.
Amazing. And I'm actually going to direct this question towards Stephanie Ellens Clark, in that One Care has mentioned a lot about reliance on staff and volunteers to provide transportation and other services. Why is there such a heavy reliance in rural spaces for volunteers for transportation services?
I think there's a heavy reliance on volunteers in general in the community support sector and in a number of nonprofits because we know that we don't necessarily have the funding, and we know that there's people in the community that want to contribute. The challenge is, though, we've seen across Canada volunteerism has gone down over the last few years. So specifically, it's a reflection of the realities of rural transportation. So volunteers make it possible to offer that flexible, compassionate, and cost-effective door-to-door transportation, and we simply can't meet the demand, the supply, or maintain enough staff and vehicles to service all the rural area that we cover. And so utilizing volunteers in providing transportation allows for us to expand our service coverage. It helps us to prevent those health inequities from widening in rural areas. So really, volunteers, they're the be all end all, and they really support all of our programs, not just transportation. Because they help with supporting independence and reduced isolation. So they're a huge crux of our sector and of our organization.
Mhm. And I would also direct that question to Sarah. Do you have anything to add about this huge reliance on volunteers that are in rural spaces?
Oh, a couple things. I mean, it's not uncommon for there to be higher reliance on volunteerism in rural places. We have what I would classify as a high level of social capital, which is a good thing. Like, people care, they want to get involved. But I would also say that what we saw in a transit space is something really strange. And between Atlantic Canada and British Columbia, we saw the ability to kind of contrast this real time. So the local transit systems we have in British Columbia, because we have a provincial transit authority that works on like a 60-40 split with our local governments, we have a high level of stability when it comes to local transit systems. But they're not very innovative. It's like bus, maybe it's a flex route, maybe if you're lucky, kind of a thing. It would be rare for it to be something other than that, like a fixed or a flexible route, maybe on demand. Not very innovative, incredibly stable. If you look at Atlantic Canada, what we saw was, as I mentioned, that high level of volunteer reliance, like an incredibly high level of volunteer run systems, incredibly unstable, but also crazy innovative because they don't have this provincial mechanism that's like holding them. They can do all sorts of really creative things. And so seeing those two things side by side made my team have a lot of conversations about how can we have a more blended model that lends that innovation and community tie-in that you get from a volunteer run system with the kind of stability that you get when there is like more support in a larger mechanism. We haven't come up with anything, but I think that there's value in considering how to do that because both systems clearly have benefits and limitations.
And thank you so much for adding that. And thank you to all the presenters for the webinar. If you have any thoughts, we would like you to share with Gateway at any point. We'd also like to thank the following sponsors for their support. Without them, the lecture series would not be possible. That includes CIBC Wealth Management, DeJager Town Square IDA Pharmacy, Hurontel, Libro Credit Union, Lighthouse Money Management, McEwen and Fagan Insurance, Zehrs Goderich. So Gateway is a not-for-profit organization with charitable status, and we greatly appreciate and welcome any support we receive. Consider us continue our efforts by funding our efforts at the Discovery Healthcare Camp. We will be continuing the conversation on April 14th, 2026 on farmers' well-being, grief we carry and roles we inherit, mental wellness in rural families, featuring Laura Van Uwick. Thank you again to our panel sponsors and especially you for tuning in.